So, hello everyone, and welcome to the Doctor Interested webinar series. We're so glad you could join us today. My name is Soham, and I'll be guiding us through the session before introducing our speaker. Before we begin, just a few quick reminders. Please keep yourself on mute unless you're speaking and stay engaged throughout the session. This will help us create a respectful and focused environment for learning. We would like to acknowledge that this event is being organized in Mississauga, Ontario, which is situated on the traditional and treaty territory of the Mississaugas of the Credit First Nation. As we gather virtually today, we encourage all participants to reflect on the lands they are joining from and to recognize the enduring presence and contributions of the Indigenous peoples across the territorial and the world. Also, don't forget to join our certificate stream. This is a great opportunity to build your portfolio, learn directly from medical school and university students, and gain recognition for attending these incredible webinars. You can scan the QR code on the screen to sign up. And now, it's my pleasure to introduce today's speaker and our Executive Director, Adil Mukhi. Adil Mukhi is a public speaker, youth advocate, and change maker. He leads initiatives that empower tens of thousands of young people, including founding Doctor Interested and contributing to the Play to Heal movement. He is passionate and mentorship, research, and leadership, and he aims to create opportunities for youth to innovate and lead. Learn more about him on his Whistle app. Please join me in welcoming Adil Mukhi.
Thank you everyone for having me here today. This presentation is going to be pretty short as I want to leave some time at the end to have questions and answers. But basically, we're going to be looking at policy and how you can get involved at a young age. I've personally found that policy is a very easy way to get involved in the healthcare area. And unlike research, it's very easy to break into at a younger age. But before you get started, I want to tell you one undeniable fact. Policy has the power to change the world. And it has this power more so than any other doctor or hospital because policy will shift the rules and the basic ideas around healthcare, around our mental health, around society in general, and will be able to impact so many lives. Today's focus is going to be our youth voices in healthcare and in health policy, and the practical and simple ways that we can get started in the area. So first, we're just going to jump right in. First, it's going to be letters to the editors. These are a very easy way to get your voice heard, to have an impact, and it's something that you can do at any age from anywhere. You're really just emailing a small paragraph or two about your opinion regarding some policy to a newspaper and hoping that people read it and get inspired to take action. My personal experience with Letter to the Editors, I have published a total of 15 in multiple newspapers, reaching thousands of readers. And I have been working with Results Canada to be doing this. And reading, okay, sorry, I'm having trouble with Zoom. And I have been working with Results Canada to do this. Recently, I have taken on the role as the National High School Lead with Results Canada. And in that role, I'm now helping other high school students write LTEs and trying to get them published, etc. So why letter to the editors matter? It's a very easy entry point. There's no experience required. Like if you know English or whatever language, really, you can do it in French. I've done it in French or whatever language in your locality. You just quickly write it. Maybe it'll take you 3-4 hours after editing and everything, and you email it one by one. But it has a really big impact. And I'm not sure if anyone wants to guess, but who do you think reads the local papers a lot? Anyone? Any guesses? Okay, I see one in the chat. Old people, yes, old people do read the newspaper quite a bit, and they vote quite a bit as well. However, there is one group that really always reads the opinion section of the newspaper. Who do you think it is? Lawmakers, yes. The people that actually make our policy, the politicians, the MPs, and usually the MP staff, they'll be reading all the LTEs in their local area in whatever area that they're serving because it's an easy way for them to see what issues their populations are passionate about. And they know that if someone has taken the time to write an LTE, that means that they're really passionate about this and that someone really wants please do not annotate on the screen as it will be quite um okay, there we go. And it's someone that's really passionate about something, and so they know that this is something that they should focus on as well. So yeah, politicians or lawmakers. Finding topics. LTEs are really amazing in the sense that they could be on any topics. They could be regarding current wars, they could be regarding mental health, they could be regarding food in schools. Whatever it is, you can write about it, and at least one or two newspapers will be passionate about what you're passionate on, and they will publish it. That being said, I would suggest looking for like trending health issues. And when I say trending, I mean like a new policy has recently come out, a new law has come out about it, or there is like a deadline. So, like for example, Gavi, the Vaccine Alliance, usually gets its funding about now where it has gotten its funding, but usually right before it, there are a lot of LTEs about why Canada or other countries should donate into the fund and help give vaccines to third world countries. And so you can look for like those sort of issues that have currently like a big sense of urgency or just came out recently and whatever it might be. But you also don't have to. Like if it is a very small thing that you're very passionate about, then it doesn't have to be trending. You could make it trending, you can write about it and you can put it in the newspaper. Um, just some tips, be concise, be human, be persuasive, include a clear ask. You really want to do a story as a way of capturing the reader. You want to have that hook at the start. You want to take them through a story of why what you're saying matters. At the end, reading about it isn't enough. There needs to be something that they can do. It could be we called on the prime minister to make to propose these changes, whatever. It needs to have something there for someone to do with it. Um, Again, just a clear structure, 150, 200 words, and a local connection. It might feel like I'm zooming by this. We will post the recording on YouTube later, so you can always just pause and look at the word count or whatever it is. Most newspapers are very strict about their word count, so do try to be in that range. Also, a couple tips I've learned when I'm emailing out papers, when I'm emailing out letters, is that usually they want it copy pasted into the email's body instead of like attached on the email. They're always going to want you to have your email address, your location, at least to the city, and your phone number on your email. It makes it easy for them to contact you and also makes them see that local connection if you're in their area. Yep, so writing personalized emails, I would suggest, I know a lot of people do like blind carbon copy and they'll just send it out to everyone. I would personally suggest doing it one by one, or at least doing it one by one to papers near you. Like if you're in Toronto, doing it to the Toronto Star and everyone, like the big papers there, one at a time, and then everyone else, you can do it regularly. You want to make sure that you are submitting only original work, so like you're not having it published twice or whatever, which is why doing it one at a time is usually considered a good practice. Local papers and following up, sending that reminder email asking what they thought. Even if they're not going to publish you, you might get some feedback for next time, and that's usually nice to have. Past that, there are a lot of youth groups. Some operate online, some operate in person, and youth groups like let me find an example. Like the Mood Disorders Society of Canada has a National Youth Advisory Council, and there are so many youth groups around the world that you can join one in your local area. So that might be in your country or in your region. And you would be able to connect with people that are passionate about the same thing as you. I would personally suggest just do a simple Google search. What you're passionate about, mental health advocacy group in Mississauga. Search it, see if anything pops up. If it doesn't, maybe instead of Mississauga, put a bigger city like Toronto. Do it again. And a lot of groups actually are very open to newcomers and youth because they know that youth have a big role in advocacy and that they are going to be the future, and it's important to get them involved early. A lot of these groups will onboard you, so they'll show you how to write LTEs, they will show you how to write op-eds, how to write policy briefs, and all sorts of things. So it's always nice to kind of get that sort of hands-on experience at the start. Yep. So like I said, they'll give you the onboarding and the campaigning skills. And then university groups. These are groups that run through universities, commonly called working groups or other youth groups as well. And usually this is like a very easy way to get involved in bigger projects and to see a bigger impact from what you're doing. Um, it is also very difficult to find these groups as usually they are very rare or sometimes they are restricted to students that go to the school. However, in my experience, I've found two or three that are open. And so I feel like it's always worth trying to see if there's something like that nearby. So this is like the best step for you if you're interested in policy, if you want to get involved early, if you want to start making an impact in how your schools handle sports and how mental health is treated across the country, in how in how vaccines and how much funding we're giving to other organizations that are doing that internationally. And it's a very easy way to get involved because they'll show you step by step what to do. The only thing you really have to do is find them. Um, so yeah, finding or trying to find the working groups and the universities or connections, you can reach out directly. Like if you're interested in sports policy, if you want to see more kids get involved in sports, you can of course just email a professor in the in the kinesiology faculty of the school and see if they know of any of the groups or if they're even running a group or doing research around it. Um, Many universities do have working groups, and most of them will have an online page. This online page will be difficult to find, so it might require like a couple hours worth of going through different websites and like kind of seeing all the links that the university has on its page and going through everything. But in the end, you will find it somewhere. And once you do, it'll be pretty simple to join in. You can just email them, or if they have a form out, you can ask. And attend events. A lot of universities do have open seminars. They will have networking events. They will have a lot of just hands-on experience events. And even if it isn't perfectly in what you're interested in, it's always worth going and asking in person if anyone knows of anything that you're interested in and if you can join in like that. Yep, and the benefits keep growing to some degree. Once you get involved in policy for quite a while, there is a very easy extension for it to become like paid opportunities, and this could be definitely like useful in university where you're looking for like a part-time job and you can actually get something in the policy area in regards to what you're interested in. And that doesn't have to be like topics like mental health or sports and stuff. You can work in different areas as well that regards to hospital policy and stuff like that. However, that you would have to wait for until you're a bit older and at least later on in university to early medical school and everything. And it gives the chance for real world impact. A lot of universities have people that are like really big, of course, and like they know a lot of people and they already have gone through, like they know how to do policy and how to make recommendations to different people. And you'll actually have the chance to submit like policy recommendations that could end up having a real impact in the world. Like very recently with the U of T sports policy group I'm a part of, we had submitted recommendations to the Future of Sports in Canada Council. And so it does give you the opportunity to have real world impact. and bigger impact compared to just doing online advocacy with LTEs and social media. It also just gives you that bit of foundation. It'll teach you the basic things you need to know. How are we doing on time? Pretty good. And then creating your own opportunities. There's going to be times when traditional pathways won't exist. This would be because like it's a very small niche. It is something that not many people are interested in, or it could just be something that maybe doesn't exist specifically in your area. And that doesn't mean you should get discouraged. In reality, you can you can just make your own group. Dr. Interested kind of started out like that. It was just an idea of like kids in high school really need a lot more mentorship in the medical pathways as they are barely getting any through the traditional school system, at least where I am. And so I decided that I would connect the medical students who want to have that chance to mentor the youth with the youth that need the mentorship, and also running other events to kind of give them exposure to the healthcare field, to policy, to mental health, and kind of help them find that thing that interests them, whether that would be in policy, whether that would be in any medical field, whether that would be in nursing, whatever it might be. And you can always just start your own opportunity. And this could be a small group meant to address that issue. Or it could be just a group of people working together, writing the LTEs, writing the social media posts to generate awareness of that topic. Um, oh, yeah. I see a couple questions in the chat. I'll get to them towards the end. We will have enough time, hopefully. So yeah, when no group exists, create your own, start your own initiative. You really just don't have to wait. I had no clue how to create an organization when I started Doctor Interested. I was just like, you know what? I have an idea. It could work, but at the very least, it'll at least help one or two people. I put it out there on Instagram and it just started working, and it got a lot of followers, and it built up to what we have now with 60,000 youth impacted worldwide. And focus on passion. It If it's something that you love to do, whether you're interested in mental health or in sports, whatever it is that you really love, that passion will attract like-minded people, and it will affect the people that you're working with. It'll make them want to work harder and to do more. Um, and in reality, it won't feel like too much of a burden starting your own thing if it's something that you're really interested in. At the same time, I would suggest start it when you have like a lot of free time. Don't do it right before exams. That is not a good idea. But yeah, passion is contagious and it'll attract like-minded advocates to your cause. Personally, when I started Doctor Interested, I had a hard time finding people at the start, but now people reach out so often that they want to join or that they have an idea or whatever. And it's just really nice to see that a lot of people have the same passion of mentoring, of just in general of healthcare, of medicine, that they're willing to join and to give their time to the cause. And then amplify through social media. This could be amplifying your own initiative, or it could just be you taking the time to make a story about what you want to raise awareness of. If LTEs are too difficult for you, you could very easily just use your Instagram story as your way of amplifying this issue through social media. In recent times, we have seen a lot of that. And I know that like usually a lot of people will have some degree of followers on your Instagram. And even if one or two of those people decide that this is like a really good cause and they also start helping, then you will get that sort of extra build up, and it'll slowly build into something bigger and bigger. So share your message, post on Twitter, no, maybe Blue Sky, TikTok, whatever it is. Build a network, connect with people. This could be a youth group, but it could also just be getting to know your local. In Canada, we have ward counselors or mayor or whatever it is, depending on how big your community is, getting to know someone in your local government and getting them interested in what you're interested about. And one thing you don't see very often on online presentations about this is document your impact. A lot of people tell you how to get started, and a lot of people tell you what to do, but I feel like they always leave out the fact that you really should be tracking every small thing. And there are a few reasons why. You should track the amount of views that you get on content. You should be tracking the amount of kids that message you about something that, like, if you're posting about vaccines and needing to donate to Gabby's fund or whatever, then if someone messages you about being interested about raising awareness about that same issue, you should try documenting that to like whatever degree you can, because first off, you'll have real numbers to share online about showing that other people are interested, real numbers to share that you have been able to create that impact. At the same time, it will also help you get different opportunities in policy. A lot of places will require an application to join their group or whatever, and having those numbers will definitely add to your application. Of course, passion is usually a lot, but sometimes you need some cold hard numbers to help as well. Um, there we go. Yep. So we have covered multiple pathways to enter health policy. And the question isn't whether you're qualified. It really is if you have that passion and if you have that sort of interest in what you want to raise awareness about. So today we covered four things. Does anyone want to quickly recap in the chat what the four big things that I had talked about were to break into health policy? You can message in the chat. You can raise your hand. Try to keep these a little interactive. Make sure people are actually listening to me. Yes, Soya? Okay, I got one in the chat. Yes, writing LTEs and joining working groups in universities. Those are definitely two. Two more. Creating your own opportunities to social media. Yes, that is definitely another one. And one more. What did you get? Writing LTEs. Yep, one more. That was a part of making your own thing, but yes, documenting your impact is definitely important. Yes, there we go. LTEs, youth groups, university groups, and creating your own opportunities. Perfect. Someone got all of them. Nice to see everyone is actually listening in the chat. Yeah, we wrote them here. Yeah. So letter to the editors, youth organizations, university working groups. I just want to go back and say that there is a difference between these two. These are affiliated with the university. They're usually going to be bigger and they'll be doing more work with government and with research and whatnot. These will usually be non-governmental organizations, and they are usually considered grassroots movements. It's a very easy way for someone to get that first exposure into something. And usually, I feel like these have a lot of community. You will have such a nice time joining one, and that you will get to join that community. If any of you are interested in global health, I would suggest looking at Results Canada. Their mission is to eliminate poverty, and it's definitely something that I have spent quite a bit of time with, as it's a very big and important mission in my opinion, and it's something that really needs to be looked at and needs to be advocated for. Yeah, your voice matters. Health policy is not for experts and politicians in suits telling us what's best. It's for people like you and me saying that this is what needs to happen. This is what the world needs right now. And you don't need permission to make an impact. You don't need permission to go ahead and advocate for what you believe in and what you think matters. With that, oh yeah. So you can feel free to connect with me. It was nice meeting all of you today. If you just connect and mention that you were here at the event, I'll connect back. Usually I don't connect with people I don't know, but as long as you mention that you were at the event, I'll love to connect with you and we can message about your advocacy journey or just your journey in healthcare. Also, if you want extra help writing an LTE or just in anything about your journey through healthcare, through medicine, whether I've helped people like make their LinkedIns, I've helped people make LTEs, I've had people just come in and ask me questions about different policy things. You can use the office hours initiative through Dr. Interested, so you join our server. Link is legitimately everywhere. We're trying to get so many people in here. We have 900, but we still like want to get more on there. Join the Discord, click on the office hours in the selection here. Scroll all the way up to me. I'm at the very top, and then you can just click on this link. book a meeting for whatever time works for you. We can meet 15 minutes. If it isn't enough, we can make another meeting and continue on. Um, and with that, we can now take questions. But before we do, I will be making you're currently I'm messaging the waiting room. Oops. There we go. Just like the last webinar, I will make a sort of channel on Discord for us to share our questions and for me to share the recording on too. Huh. Can everyone hear me fine? Sorry, it says my internet's not working. Just stop sharing. Okay, if everyone can hear me, perfect. I guess whatever it is on my side. I'll just leave my camera off for now. Any question? Oh, I saw so many questions in the chat. One sec, let me get up there. Um, yep. So can this help with getting into med school? I think med school definitely looks into passion, looks into extracurriculars. So definitely like having an impact and just being passionate about something shows people that like you're willing to work for what you're interested in. And so clearly like that is definitely something that they're wanting to see. Can this advice also apply to policies other than just health policy? Yeah, definitely. Policy in general is about, well, the youth side of it, at least, like the easy way for youth to get involved in youth advocacy regarding policy is you would need to kind of get your voice heard through the LTEs, join the groups that are working on the same topics, and if nothing like that exists, creating your own group. There are lots of, like, of course, there are laws on everything. And so if there's something that you're really passionate about, there's probably going to be someone else that's really passionate about the same thing. I had actually met someone that was like super passionate about youth under 18 having that right to vote. And it's so cool that they like created their own community from it. And so like you can definitely make a community or find a community or just start writing LTEs and social media posts about whatever policy that you want to have a change and effect on. Um, I think I have gone, yes. Yeah, the person with their hand.
Hi, thank you. I just wanted to thank you for this webinar. It was very interesting. I just had one quick follow-up question.
Yep.
So for the LTEs, like when I'm like looking for different organizations or like newspaper outlets that cover on that topic, do you mean like kind of like any like I'm just trying to figure out like so should I like try and find outlets that are like specific to like health policy or ones that just talk about it, if that makes sense? Like, you
Yeah.
know?
So what I would say by that is like any newspaper, most newspapers will have
Mhm.
an opinion section and they will publish LTEs. The only thing is looking through that newspaper to see if they've had your type of content covered.
Mhm.
What I found in my experience is that some newspapers really like stay away from certain topics, like that might be regarding current wars, it might be regarding more political issues in policy that they might decide not to cover. And so it'd just be a base submitting to them. So just seeing if something that you're interested in has been published before, for that to kind of like be there. What grade did you start Doctor Interested? I started in grade 10. I hope that answers your question, Rokia. Sorry,
Yeah,
I didn't
thank
pronounce
you.
your name right.
No,
Of
you're
course.
fine. You did. Thank you.
Thank you everyone for joining. This meeting is about to end.